Hi, Andrew from Sax, and welcome to video number 3 in our 10 video sequence on the relationship between psychological assessment and mental health and mental illness. And in this one, we'll be talking about the question of therapy. Does therapy work? Now, that might seem a surprising question because, of course, people get therapy all the time, don't they? And going back several decades ago, there was a very famous paper by a very famous psychologist called Hans Eysenck, and he said, from his meta-analytical research where you look at a whole bunch of studies, he said it actually doesn't work. It's better than nothing, perhaps, but not much better than nothing. And then, of course, there was this massive backlash from the therapeutic community to say, well, of course it works. And the truth seems to be somewhere in the middle. Let's have a look at the evidence. So we know that if you look at talking cures, well, talking to somebody definitely makes people feel better. But the interesting thing is that 20 to 50% of those seeking treatment drop out. So 2 studies there, one saying 20% and one saying 50%. But certainly, if you're going to ask people whether it's worked for them, and 50% of the people who you're studying have previously dropped out, well, presumably only the ones that are left are the ones that liked it and felt it was helping them, and maybe it reduced their symptoms or whatever. So it's a big methodological weakness, the dropout factor. And certainly if you've got a dropout factor of 50% for anything, that's not a real confidence builder in that method. We also know that placebo effects can be very powerful. And so, there have been lots of articles written in medical journals about all of these organisations across the world that turn over billions of dollars that sell everything from vitamins to different types of tonics or whatever. Well, frankly, most of them make absolutely no difference whatsoever from a medical point of view, but people think they're doing something and they feel better. That's what the placebo effect is all about. Well, obviously, counselling has a big placebo effect as well. How about cognitive dissonance? The idea of cognitive dissonance is you've gone along, you've sat in a chair, you've been therapized by somebody, and you've paid money for it, and after you've been through all of that, and someone asks you, did it help? Well, there's a thing called cognitive dissonance, which makes it more likely that you'll say yes, because it's internally cognitively dissonant to say, well, no, it didn't, because what kind of a fool am I if I've been through all of this, paid all this money, and it hasn't helped? So cognitive dissonance theory says that we tend to adopt viewpoints which reduce our internal cognitive dissonance. Now, this is not a made-up thing. Cognitive dissonance is, as my daughter would say, a thing, and it does affect very strongly the opinions that people have. So cognitive dissonance may cause people to overestimate the degree that therapy has helped them. Now, one of the things that we do know from recent research is that treatment modalities seem to be relatively equal in terms of their effectiveness. I've very rudely put an in brackets in front of the effective. But what that says is that it doesn't seem to matter what the method is, whether using a contemporary method or, time-honoured psychotherapy. It does seem that they have a similar level of effectiveness. So the effectiveness of psychotherapy seems to be largely generalised, determined by common factors such as how the person gets on with their therapists. And it certainly casts doubt on the medical model, which posits specific treatment effects for specific diagnoses. And the question is it better than drugs? Now, Kuipers, by the way, is a very serious researcher and very credible. And what he discovered is that, in general, if you look at the degree to which people are medicalised versus psychotherapized, you'll find a relatively small difference. And Joe et al. Found that pharmacotherapy alone was more effective than psychotherapy alone. So the combination was the most effective in his findings. Now, there are a bunch of contemporary methods that are kind of neurological of their nature. And I think one of the things that's fascinating about this is if you look at methods such as, for instance, cognitive behavioural therapy, acceptance and commitment therapy, which is kind of a version of mindfulness, which the third method is, and things like eye movement desensitization and reprocessing, what that's really saying, those methods are saying, look, these are largely neurological in their nature, and it doesn't really matter so much where they came from. If you've got a phobia, for instance, the classic Freudian perspective is, well, we've got to find out where that phobia came from, and we've got to deal with the issue that caused the phobia in the first place. More contemporary methods take the view, well, actually it doesn't matter that much. Let's see if we can reduce the phobia and get the person functioning again. And in fact, techniques like eye movement desensitization and reprocessing take the view that, well, let's call up this dysfunctional mental pathway, this neurological pathway, and then let's disrupt it, usually by eye movement. So some of these contemporary therapies have significant benefits. One is that you don't have to go into the deep, dark, distant past of a person's childhood to deal with things, and so they can be much quicker. But also, they're starting to show really useful clinical effectiveness. The other thing that we should be conscious of is therapy doesn't always do good stuff. It can hurt you, and between 3 and 10% of people who go through therapy actually get worse. So they might develop new symptoms, and it might lead to stigmatization. So if a person tells people, look, I'm going through therapy, maybe that's going to cause them to see that person in a slightly different light. And suicidal thoughts can come from therapy, damaged relationships, dependency, and reduced self-efficacy. So reduced self-efficacy is about a person losing their confidence to deal with things and to feel, I need help. And of course, dependency is a risk of therapy. If you become dependent on your therapist, then it may well be that you're less effective in dealing with your own issues. Now, this is a brief description of the work of Paul Meehl's disturbing little book. So Paul Meehl asked a bunch of therapists to predict things like, for instance, will this person get better? Will they need to be hospitalized? And he discovered that when you asked people these questions, they were terrible at predicting what was likely to be the outcome of the patients. And so he recommended statistical models of doing these kinds of things, algorithmic models, where you identify through research certain predictors of what's likely to happen with somebody, and then use a mathematical model to predict. It's an algorithm is what you call it. Use an algorithm to predict what's likely to happen with people. And what he was able to demonstrate is that algorithmic methods are vastly, in most cases, more accurate than therapeutic methods where you're getting the clinician to predict what's likely to happen. By the way, that applies to the rest of the world as well. That's one of the reasons why people use psych tests to hire, because a combination of good psych scores is a pretty good predictor, whereas people's personal impressions are nowhere near as good. That addresses the question of psychotherapy and its effectiveness. In the next video, we'll be talking about why people are as they are, and we'll be addressing the question of what we like to call nature, luck, and nurture. So you've heard of the nature-nurture debate. This is the fact that there's a new component that has been identified, and that's purely and simply genetic luck. Click on the link there, this video to join us.